Good evening, everyone. If I'm audible, please just let me know in the chat box. If I'm visible, I'm audible, right? Screen is visible, especially for you. My voice and the screen is important thing. Am I audible to all of you? Can you just let me know, please? Can you hear me? Am I audible to all of you? Okay, perfect. Okay, let's begin. Am I audible to all of you? Hey, Kesavin, how are you? So I hope you have done exam very well. So I am late today to come up with the recall questions. I got like many questions, more than like 16, 70, but I skipped a few because they were part of more of the pharmacology and the pathology, and I would like them to explain to you in a much better way. Okay, so here we go with the first question. Okay, which of the following enzyme contain selenocysteine, right? We know, what do we know about selenocysteine? We have done this various times in the class. It is 21st amino acid, right? And there are enzymes which contain selenocysteine, especially in their active site. And we have done that in the class as well. These are from the class notes, the notes we get from the Notespedia, right? From the Notespedia, right? We know about this 21st proteogenic amino acid, selenocysteine, which is coded by UGA. That was a previous recall question. In the previous exam, we have done that, right? And this selenocysteine was formed based upon the not the post-translational mechanism, but the co-translational mechanism, right? And there are several enzymes such as glutathione peroxidase, deiodinase, and thioredoxin reductase. Okay, these enzymes, glutathione peroxidase, deiodinase, and thioredoxin reductase, right? So thioredoxin reductase, peroxidase, and deiodinase. These are the three enzymes which contain the selenocysteine, right? Not the glutathione synthase. So probably this question was a multiple choice question, right? So the A, B, C are correct, right? So I would first of all request you guys, if there were other options present, to let me know so that I can rectify it now, right? Otherwise, these questions are based upon what you guys have remembered and shared it with me. But the important aspect from the question is to know that particular topic. We now, because this selenocysteine is comes under the high yield topic. So we should be knowing about their structure, about their synthesis, about the codon, enzymes it is related to, or if there is any special mechanism it is involved in. Okay. So to this is the A, B, C, D, three choices are correct. Okay. And those students who have attended the classes, they know it very well. Now, next question was properties of HMP pathway are all of these except HMP pathway, which stands for hexose monophosphate shunt. What these were the choices given to you. What these were the choices given to you. Anybody like to add on or delete, like make me erase some of the options or change some of the option? We know there are several names of HMP phosphate shunt. That's also we have done in the class, which is available to you via the Notespedia also, right? Pentose phosphate shunt, hexose monophosphate shunt, Dickinson-Horsky pathway, which we least heard, but sometimes they're tricky with that also known as phosphogluconate pathway. And it is an anabolic pathway. It does the synthesis, right? In the cytoplasm. It does the synthesis of what? We know there are two important things that are involved, right? One phase is oxidative phase that gives you NADPH. Another phase is non-oxidative phase that gives you ribose of 5-phosphate, right? That gives you ribose of 5-phosphate. That we have done this in the class, oxidative phase, non-oxidative phase, right? Oxidative phase is irreversible. You get two molecules of NADPH, right? And then non-oxidative phase is a reversible phase, right? And what you get is ribulose from oxidative phase converts into ribose 5-phosphate, right? And which we know is an sugar, right? And which is used in the synthesis of the purines and pyrimidines, right? Purines and the pyrimidines. So coming back to the choices here. So NADPH produced, right? Is it ribose, I guess, produced, which is true also. Ribose is consumed or acetyl-CoA is produced. These two are now, we have to think about it. Do we consume ribose in the HMP pathway? We don't, right? So probably this is the correct choice based upon the knowledge we have received in the class, because we never go beyond that. But acetyl-CoA can be produced from HMP if you just think a little bit more about it. This was the bigger chart which I have shown you also in the class this is from the Harper's. But we don't have to do the entire pathway because HMP is a big pathway, right? It's full of complicated steps. So it started with 3 molecules of glucose 6-phosphate, right? And in the end, 2 molecules of glucose 6-phosphate plus half molecule of glucose 6-phosphate, 2.5. What does that mean? Half means glucose is a 6 molecule, right? 6 carbon molecule. It means we are getting a 3 carbon molecule, glyceraldehyde 3-phosphate, right? Which can produce the pyruvate. And from pyruvate, acetyl-CoA can be formed. So in a way, we can guess it, like maybe few of you have guessed it right, but this was to we could easily make it out that acetyl-CoA can be produced. NADPH, RB ribose can be produced only. The false statement is ribose consumption. It do not consume the ribose. Okay, am I clear up to this point? Any doubt, any change you want to make? Now, the question number 3 was Refsum disease is due to deficiency of which enzyme, right? Refsum disease. There was another question with the Zellweger syndrome, right? And we have discussed this at 2 places in the class. One in the fatty acid oxidation and another one in the peroxisomes when we did the cell organelles, right? Because these both diseases are related to the peroxisomes. We know the regular beta oxidation is this regular beta oxidation. Regular beta oxidation is this, right? What does that mean? That you have acetyl coenzyme A dehydrogenase, which is going to chop off two molecules, right? Two molecules, acetyl coenzyme A, and then you get the acetyl coenzyme A. But that is, you have very medium chain fatty acid. Odd thing happens when you have the branches, and odd chain things happen when you have the side chain. Then the scenario changes, right? If you have the branches, then you undergo that the molecule, the fatty acid has to be taken to the peroxisomes where they are trimmed so that you have the medium chain fatty acid and the regular beta oxidation takes place. Same place if you have, branches, side chain is one and the same thing, very long chain fatty acid. That is more than 22 carbon, I wanted to say. I'm sorry about that, okay? So if you have very, very long chain fatty acids, even those are taken where in the peroxisomes, they undergo alpha oxidation first. Alpha oxidation trimmed them down up to very small kind of fatty acid, and that fatty acid is now transferred to the mitochondria where the regular beta oxidation happens, right? So very full length chain fatty acid and the branched chain fatty acids are the 2 different versions. Branched chain fatty acid, the example we have learned about the phytanic acid, which was the 20 carbon fatty acid, and this is how it looks like, right? From the notes that is a phytanic acid. So first it is taken down in the peroxisome, and then there is an enzyme which which removes the methyl group, which is acting as a branch, so that it is kind of a linear thing. And then your regular enzyme, acetyl coenzyme A dehydrogenase, can chop it off into acetyl coenzyme A, that is a 2 carbon fragment, and then the whatever it was going in a regular fashion that can be carried upon, right? So deficiency of this enzyme, which is removing this branch chain, the enzyme is Phi-H. Deficiency of that enzyme leads to the Refsum disease that we have done this. That phytanic acid is coming from the milk product. So if a person is suffering from Refsum disorder, the first thing is stop giving the dairy products. Okay, we have done like this in detail in classes with all these tables and the figures, right? And the adult, like it is characterized usually when the person grows up, and then most of the sense organs are affected. Patient will be suffering from retinitis pigmentosa, loss of smell will be there, bone abnormalities. Do you see this finger? This is the characteristic of the Refsum. Peripheral neuropathy, cerebral ataxia, brain will be highly impacted, skin will be there, and the loss of hearing will be there. So eye, ear, your skin, your brain, everything is getting damaged because of the accumulation of the branched chain fatty acid, right, in the peroxisomes. That is your Refsum disorder, right? So there was another question, right, in other half, that was also a peroxisomal disorder, and that was Zellweger syndrome. Zellweger syndrome is related to the very long chain fatty acid. Again, very long chain fatty acid oxidation takes place in the peroxisome, right? So this part we have done where in the cell organelles, where we discussed all kind of peroxisomal related disorder, right? And the Zellweger syndrome is because of the mutation in the PEX gene. In the PEX gene, that leads to what? The patient suffers from the Zellweger syndrome, and the characteristics are the craniofacial malformations, that is seen by like in these figures. And what were those? Even I have given you those also: the broad nose bridge, epicanthal folds, flattened face, high forehead, eyebrow ridge, right, wide set of eyes, right. Other than that, the hypotonia, floppy baby syndrome was there, right, ocular abnormalities, developmental delays, all those things we have discussed in the class. So peroxisomals are two. One is the Zellweger, one is the Refsum. Zellweger was because of very long chain fatty acid, and the Refsum was because of the branch chain fatty acid problems. Okay, and we have done this in detail in the class. Okay, now coming back to the question, what was the question? Alpha oxidation in the peroxisome is the choice, or alpha oxidation in the mitochondria and endoplasmic reticulum? Alpha oxidation is happening. Alpha oxidation always happens in the peroxisomes. That is AP. Right, AP, alpha oxidation helps us in the peroxisome, and the related disease are Refsum and the Zellweger syndrome. Okay. Now, there was this question, very simple, straightforward question, which is again one of the high yield topic coming from the lipids chapter. Young male with a history of dyslipidemia having ABCA1 mutations, right? And this was the figure given to you. And we know when you see this orange color tonsils, right? Right, orange is tangy. Tangy ones comes from tangerines, right? Tangerines, those who really know the small oranges, right? In America, they call it as tangerines, and they are really tangy, sweety tangy. The taste is very, very good, right? And that relates to Tangier's disease. So answer to this is the choice A. In, I don't know the series of the option, like how in which order they were given to you, but Tangier's disease with the tangy color, tangy taste, that is orange, right? And we have done this in the class also. If you can recall, various type of dyslipidemias, we can categorize them into the hyperlipidemias, hypolipidemias, right? And hypolipidemias are of two types, that is Tangier's and the A-beta lipoproteinemia, right? In the Tangier's disease, which is because of the ABCA ABACA1 gene, right? There is a decreased synthesis of HDL, right? Not just the orange tonsils, but you may see the grayish tonsils, along with peripheral neuropathy and hepatosplenomegaly. This question has come, maybe was a part of a recall question 1 year ago. So now you must be going through recall questions, right? Those who are planning to take exam, right? So you must go over the recall questions. You should, and we have discussed this in GTs also, right? So GT is also helping you in that, right? So let's do the next question. That is question number 5, and that was about enzyme glycogen phosphorylase, right? So name is telling you that is related to the glycogen metabolism, right? It's activated or deactivated by. I always emphasize on regulation. See, guys, trust me on this, the way the pattern is changing. The Indian Medical Association are like more towards the USMLE pattern now, right? It's not exactly questions you're going to get here, but you have to understand regulation is very important. Reason being, regulation is important. Only if the regulation is disturbed, there are higher chances to get a diseased condition. So what is going up and down, and what are the factors which are influencing the increased and decreased levels of the concentration of that particular substrate is very important to know, right? So here comes this question: glycogen phosphorylase is activated, or like is directly activated or inactivated by, right, calcium, glucose 6-phosphate, insulin. And one of the student just texted me, ma'am, that was cyclic AMP glucose. What was that, right? What is glycogen phosphorylase? Glycogen phosphorylase is enzyme which breaks down the glycogen. So that is activated during the fasting condition, right? Overnight fasting brings the glucose from the glycogen stores by breaking down the glycogen so that glucose is available for you under the fasting condition. And we have gone through this regulation table, right? You must have this in your note, right? So glycogen phosphorylase is activated, right, at two places: in the liver, in the muscle. right? Liver and the muscle. In the muscle by epinephrine, AMP, not the cyclic AMP, just the AMP, the calcium ions via calmodulin, right? So this is how it is being activated. And in the liver, it is activated by epinephrine and glucagon. And also we know that epinephrine and glucagon are the hormones whose level increases during the fasting condition, whereas insulin level increases during the fed conditions, right? So glycogen phosphorylase gives you glucose. It means you're going to break down the glycogen. So means you are under fasting condition. So you mean glucagon levels are up, epinephrine levels are up, the calcium levels are up, and the AMP. In the rush, many students, they tend to make this mistake. AMP is a low energy indicator. Low energy indicator, because you can convert AMP to ATP, sorry. Okay? Whereas the cyclic AMP is what? Cyclic AMP is the secondary messenger. Secondary messenger. So it carries the message from outside of the cellular membrane to the inside. That leads to the cascade of events. So finally, whatever is needed to be done by the cell is taken place. Maybe it is a release of a molecule or something else. That is a secondary messenger, right? So the choice was given was calcium, glucose 6-phosphate, glucose. These are the products. Insulin is fed condition. Cyclic AMP is a messenger. So it is directly or indirectly activated by the calcium in the muscle. Could be the add-on point they may give you next time. Okay. And we have done this in the recent GT exam, GT class also. Those who are taking the GT, they must have seen this slide also. This is the glycogen, right? The left half, this half is the synthesis and this half is the breakdown, right? So glycogen phosphorylase, first chop one molecule of the glucose one by one, right? That is glycogen phosphorylase. And there are two isoforms of the glycogen phosphorylase. Okay, Dr. AKK, AMP also in the option. Okay, thank you. So there are two isoforms of the phosphorylase, that is the muscle phosphorylase and the liver phosphorylase. And these are like also related to the glycogen storage diseases, right? They may ask you in the next exam. So just know this, right away, because this is a part of a high yield topic, right? Muscle phosphorylase deficiency, muscle phosphorylase deficiency leads to the McArdle syndrome. Muscle McArdle syndrome, also known as myophosphorylase. Everything is right? Myophosphorylase. And what are the symptoms? What are the poor exercise tolerance? So you can have this picture in your mind. Okay, muscle is not working very well, and then what you have, the exercise tolerance will be very, very low, right? Exercise tolerance will be very, very low. So bicycling and all those things for a teenager is hard to perform. And what other things can be? The blood lactate levels are low after the exercise. Blood lactate levels are low after the exercise. What does that mean? Glycogen phosphorylase is breaking down the glycogen that would have given you the glucose. If you don't have glycogen is not broken down, you are not getting the glucose, right? So how you are gonna take the glucose, make the pyruvate and the lactate? So it means there will be low lactate levels, right? And then there is the liver phosphorylase. That is another isoform of the phosphorylase in the liver, and deficiency of that leads to the HERS disease, right? HERS disease. Everybody, HERS disease. How you are going to remember it? HER is female, and everybody loves their buddy, right? The girlfriend. So that is the H and L. That's how I remember it, right? Sabko apni bandi se bahut pyar hota hai. So H, HERS is the liver phosphorylase, and in this what we see, since this is the liver phosphorylase, we see hepatomegaly, and there is mild hypoglycemia. This is like a milder version. But the question arises, if the question was very tricky once upon, and like the student was asking me, that was, ma'am, what is the difference between the McArdle and the Thyroid disease? How we are going to make the difference? Because there, in both the cases, there is poor exercise tolerance in both the cases, poor exercise tolerance, right? Muscle glycogen abnormally high in both the cases. Blood lactate low after exercise. Only one difference is there, that is hemolytic anemia is there in the Tourette disease. Reason being the enzyme deficient is the phosphofructokinase in muscles as well as in erythrocyte. That leads to the Tourette disease or Roy's disease, whatever way you want to tell it. Okay. So coming back to the question 5, we know now the answer is the calcium, right? And those who will be taking like exam soon, now they know. My screen is freezed for some reason. Okay. Technical issues. Now, the next question was cystic fibrosis is caused by which of the following deletion? Very, very simple question. That is cystic fibrosis. We always have talked about it is because of a deletion mutation, right? What has been deleted at 508 position. So definitely this was the wrong choice because that is 805. And what was gone for fibrosis? For phenylalanine, right? And I always emphasize, I don't know whether they gave you the full name of the amino acid or the 3-letter abbreviation or 1-letter abbreviation, right? And we always emphasizes on that. Tyrosine is Tyr, T-Y-R, right? Phenylalanine is Phe, and 1-letter abbreviation is Pher. So if you don't know the abbreviations also, those who never knew it, like it's hard to make it out. So for fibrosis, is for phenylalanine, that is Phe at the 508 position. So that was choice B. That was choice B. Okay, was the correct choice, and we have done that at like 2 places about the cystic fibrosis when we discussed about the CFTR thing, right? The cystic fibrosis is an autosomal recessive disorder. Because of this deletion mutation, there is a problem in synthesis of the CFTR chloride channel, on the problem with the chloride channel, right? And how it is related is MC in adult. Okay, so coming back to this one, right? This cystic fibrosis, it is autosomal recessive disorder and there is no cure. No cure. In the gene therapy section, we have done this, right? That there is a gene replacement therapy available for the cystic fibrosis, and now that's how it is done. But it is like just, we are trying to do it, but still there is no cure, easy cure for that, right? And because of the mutation, right, in the CFTR gene, this was one of the recall questions in the previous exams, right? On where the long arm of chromosome number 7, on the chromosome number 7, right? So what you have is this gene is there. Because of the mutation, it cannot form the CFTR, the channel, it is not formed properly, and that leads to, that affects various organs, because CFTR is available at various places, like in the sinuses, right? If it is not working, then sinusitis, it can lead to the pancreatitis kind of issues, because it is there in the pancreas, in the intestine, so digestive problems can be there. Reproductive system, it is present, so decreased fertility in the lungs, so pulmonary disorders, and the sweat glands, it increases the chloride levels in the sweat. So these various complications are there in the patients suffering from this CFTR thing. And what is the CFTR? CFTR are the transmembrane proteins. These are sort of channels in the apical membrane, right? In the apical membrane of the epithelial cell. Membrane of epithelial cells, right? And they help regulate the bicarbonate ions as well. So this is what happens is the sodium ions, they go outside, right? They combine this, sorry, it's not sodium, I'm sorry, the chloride ions, they go out, right? And in return, the sodium ions come in, and that is how it is being regulated. Eventually, there is outward flow of the water molecules, which is designated by all these dots. So what it does, it helps us to clear the ciliary, like promotes the optimal ciliary clearance. So whatever are these mucus or the particles, they are being washed out. They are not being stuck there. So what happens is, in the case of the mutation, right, this mutation, there is decreased CFTR activity or no CR activity. So this ciliary movement is not there because the water molecules are not there. So everything in the mucus is sticking, bacteria are sticking, they are not being washed away, giving rise to the disorders, various disorders, right? So there was this question also in one of the previous recall, not this recall. So I want you to revise that also, the total CFTR activity, right? So total CFTR activity is the number of the CFTR channels that are present on the apical surface, but how many channels that are opening and closing and how many channels are conducting. So based upon the mutation, based upon the state of the body, that varies. So if you take all of them, multiply it, that gives you the total CFTR activity, right? That gives you total CFTR activity. Okay, now the question was given, you know the mutation, you know why it is happening, where the chloride channels are present, why they are needed, right? If the CFTR is not working properly, what kind of diseases it can be producing because of the sticky mucus, the bacteria will grow and the secondary infections will be happening. And now we also know the total CFTR activity. That is holistically a entire topic of the CFTR or the cystic fibrosis thing. Very, very easy question about the SARS-CoV-2 virus, which I have covered in the YouTube channel, YouTube video also for the CFTR, where we talked about the CT value, right? SARS-CoV-2 diagnosis is done by all except this is a virus, right? SARS-CoV-2 is a virus, right? RT-PCR is you have the viral genome, you convert, that is viral genome is the RNA, right? You convert it into DNA and then you perform the PCR. So RT-PCR you can done, real-time PCR you can done, immunoassays we done. We don't do the southern blotting. We don't do any kind of southern blotting is not done because if you know this formula, snowdrop wala, right? Snowdrop, what was there? The southern blotting is for the DNA. It was northern blotting that was for RNA, right? So this is completely incorrect. Very simple, very straightforward question, right? And we have done this one also on the YouTube video, right? On the COVID CT value. Again, very simple, straightforward question. The burnt sugar smell, that is MSUD. That is the branch chain amino acids we are talking about. And those are, I love Varsha ma'am, isoleucine, leucine, valine, right? First is the transamination is done. If that is not happening properly, right, then one biggest disease in this, like, is the MSUD related to the branch chain amino acid, and another was the isovaleric acidemia, right? So MSUD, what you have this dehydrogenase enzyme is absent, right? So what happens is there is an accumulation of the branched chain amino acids. So that leads to branch chain ketoacidosis, leading to the difficulty feeding, lethargy, failure to thrive, and in the urine you see the maple syrup. That is a burnt sugar smell. And there are classically like 5 distinct phenotypes: classical, intermediate, intermittent, thiamine responsive, in which patients, if they are given the thiamine, they respond to the treatment, and then the dihydrolipomide dehydrogenase, right? And the test is the Rothra test, the DNP test, and what we are looking for in the Rothra test, the purple ring, right? And there is also dinitrophenylhydrazine test, which gives you the yellow color precipitate. And the branch chain, like any food which contains the branch chain amino acid, isoleucine, leucine, valine, they are being restricted, and thiamine supplements are given to the patient. This is one part in the branch chain. Another very, very important part was, which was not in the question paper, but is another highly topic. I just want to give you that insight also, because there are many students who are like, ma'am, also give me something else, because if this question has come this time, this is not going to show up like very recently, but maybe another question from the same topic. So that could be another question in coming up exam, that is branch chain keto acid dehydrogenase, right? Remember, pyruvate dehydrogenase is the one we should know the structure about. Similar is this keto acid dehydrogenase structure we know about, because it is a huge complicated enzyme complex. This contains 3 enzymes, E1, E2, E3. E1, E2, E3, along with what? Along with 5 coenzymes. Thiamine, lipoic acid, coenzyme FAD, NAD positive, right? Pyruvate dehydrogenase complexes is also of a similar nature. This is also of a similar nature, right? So we need to know the structure of the branch chain keto acid dehydrogenase, and this is a mitochondrial enzyme. This is not a single enzyme, but this is a multi-complex enzyme, like the biggest enzyme, which is grabbing so many enzymes, 3 enzyme complexes, and then coenzymes along with them, right? And the name of E1, E2, E3 enzymes we should be knowing about. Yes, you have to remember this branch chain keto acid dehydrogenase, which is the main name of enzyme. Then dihydrolipoyl transacylase and dihydrolipoamide dehydrogenase, right? And if not treated properly, like if it's not taken care, then the patient with the disorder, MSUD disorder, die in the infancy with the severe lactic acidosis, okay? Another question, number 9, very simple again. What do you see here? Crumpled tissue paper appearance, right? And we have done all these images. We have gone through all these images in the class, right? This is a cherry red spot. It is seen in all kind of sphingolipidosis you come across. So just don't rely on that. The Gaucher cell, we know we look for the crumpled tissue paper appearance. In the Niemann-Pick disorder, what we are looking at, the bubbly appearance, means the foam cells, because there is the lipid-laden macrophages that gives a foamy appearance, right? Whereas in the crab cells, what we are looking at, the globoid, not the foamy, but the globoid, right? And in the metachromatic leukodystrophy, right? Metachromatic leukodystrophy, we are looking for what? The staining. If it is stained with sulfatide, it gives you this brownish color. Right? In the Tay-Sachs, what we are looking for, the onion skin, that like these kind of words are there, right? That is the Tay-Sachs disease. In the Niemann-Pick disorder, what we are looking for? We are looking for the zebra bodies, that black, white stripes inside the lysosomes, right? So this was not very tricky, very easy. Thank you, Birhan. Thank you very much for appreciation. Question number 10 is fructosamine is the glycosylated product for which of the following? First of all, I will say make it glycated first. So this is first question. What is glycation? What is glycosylation? Glycation is without the enzyme, right? So you have a protein, right? And then there comes a glucose or a carb, anything. Let's say glucose comes and gets attached to it. This process without like enzyme being used is glycation. That usually happens when you have hyperglycemia. Meaning what? There is a too much level of like glucose available definitely in the diabetic conditions we talk about, right? Then it gets attached to the protein. That is why for the hemoglobin, like for the diabetes, we look for the glycated hemoglobin. Hemoglobin does not like the glucose very much, but given the condition in the diabetes, you have very, very high levels of the glucose, right? They forcefully get attached to the hemoglobin, not enzymatically. They just get attached because there are so many of them are available. So that is glycated hemoglobin. Now there is another term, glycosylation, in which there is this enzyme which helps attach the carb to a protein. That process is glycosylation. Okay. Now fructosamine is glycated product. What you have is you have a glucose or a fructose that gets attached to a primary amine, right? When they get married, they produce a baby known as fructosamine, which do not stay as such, right? This married man wants a girlfriend, an extramarital affair, so it gets attached to the protein, right? And that protein, the most abundant protein is the albumin, and that is albumin. That is how it is found in your blood, right? Fructosamine is never found alone. It is found with the albumin, right? So it is like found with the albumin. It is not the product of glycosaminoglycan, tyrosine. But if the question was different, Karthik, which question option was urea? The previous one you said? I did not get you which question you are talking about, Karthik. If you can just clear that point. So coming back to this fructosamine, if you can see what they were asking you, I'm not sure what the question was exactly. But now you know what fructosamine is. It is a glycated product. It is attached with the albumin, right? And similar, like the way we find the glycated hemoglobin in the diabetic patient, same way in some patients we test for the fructosamine to get a better estimate. And if you can read this is very, very important, right? Because we don't do this much in the biochemistry portion, but this will help you in the diagnosis, right? Fructosamine testing determines the total serum proteins, though albumin is very, very high level, and albumin half-life is approximately 20 days, right? So plasma fructosamine levels reflect the recent changes in the blood glucose, which is very important, especially in the patients who are suffering from like hemolytic anemia, hemoglobinopathies, or the sickle cell disease. In those patients, measuring glycated hemoglobin to test the sugar level is not a very good way. Rather, we will check the fructosamine level. Okay. Now, next question. There was this assertion reason question. Assertion was the mousy order is seen in PKU. Is that right? Yes, this is right. Correct. And then reason was there is decrease in tyrosine, dopamine, and noradrenaline. This statement is correct, but this reason is not correct, right? This statement independently is a correct. Now, so what is the option? Assertion is correct. The reason is also correct. Is this reason an answer for this assertion? No, this is not. Assertion is correct, but the reason is wrong. I would pick this because this reason is not the correct reason for the assertion. We know in PKU what happens is like you have phenylalanine. From phenylalanine, what we do, if we do the phenylalanine hydroxylation of the phenylalanine, what we get the tyrosine. Any deficiency in this phenylalanine hydroxylase enzyme gives rise to phenylketonuria, which leads to the accumulation of lots of the phenylalanine, which ultimately gets degraded into phenylacetate and phenylactate. Phenylacetate and phenylactate that we have done. See, Phenylalanine will be accumulated. It will undergo transamination. So amino group will be ripped off and alanine will become pyruvate. So the product will be phenyl pyruvate, which will be degraded into phenyl acetate and phenyl lactate. Phenyl acetate is the product. This is another very important thing. Phenyl acetate is the one which is responsible for this mousy order. This was previous recall question. So know both of them together, right? Now, coming back to this, the tyrosine. From the tyrosine, we make dopa, we make dopamine, then norepinephrine, then epinephrine. Right? Tyrosine also give rise to melanin. We have done this in class, and also the thyroxine hormones T3, T4. Okay. So if this is halted, if this is not taking place, definitely everything related to this is going down, which is true. Dopamine, norepinephrine, epinephrine, whatever was there, it is gonna go down. I don't know whether it was adrenaline or what, but now you know how you are gonna make things out. Okay, definitely mousy order is there in the phenylketonuria, but this is not the true option because of the deficiency of phenylalanine hydroxylase is the correct reason, or correct reason could be because of the accumulation of phenyl acetate, which is responsible for the mousy order. Okay. Both correct, but not explanation, right? That is true, Dr. Avilo. I really appreciate. Yes, you are getting me. Okay, they asked you this, that if both statements are correct, both statements independently are correct, right? I have told you that. But the reason is given is not the reason for the assertion, right? Synthesis of testosterone, always a hit. They always ask you a question on this topic, right? The steroid hormones thing. What is the correct sequence of the enzyme used? Last time they asked you about the deficiency of the enzyme, right? And we have done this, that the various steroids, when we did the cholesterol also, testosterone, estradiol, progesterone, all these are the steroid, and they are synthesized in the adrenal cortex, ovaries, placenta, testes, right? All the places. And that's the sequence how they are synthesized. You have the cholesterol first, that is 27 carbon. If you remember how many carbons are there, then that will make your life easier in a way, because you know the shorter fragments can be synthesized from the bigger ones. 27 carbon, you break it down. Yes, Ashish, both reasons and assertions are correct independently, but reason is not correct explanation of assertion. Very good, Ashish. So cholesterol is 27 carbon. The synthesis we have done from cholesterol, we synthesize the pregnenolone, which is 21 carbon. Then the progesterone, which is 21 carbon, same thing, but there is a rearrangements, right? And then from there, we can synthesize cortisol, aldosterone, estradiol, and the testosterones. And this is how they look like. You don't have to remember the structures, but you can really get a feel what kind of they look like. They are steroids. They are very rigid system. And this I always talk about, many times in the class also, many times in the, when we took the queries session, doubt solving sessions, and also in the GTs, we have discussed this. This is a really good chart coming from the Lippincott, and I really don't want to change anything because this tells you a whole lot of things. Last time, they asked you about this 17 alpha hydroxylase deficiency, right? Is because it will lead to what? It will lead to elevated level of the progesterone. And since progesterone is not converted down further, there will be lower levels of the testosterone. Now, in this question, in this exam, in this version, they are asking you the series. So what do you have? The desmolase. Then you have the hydroxysteroid synthase. I don't know the options. So I'm just giving you the name of all the enzyme. 17 alpha hydroxylase, right? And then the 17 beta hydroxysteroid dehydrogenase. Question, do you have to remember names of all the enzymes? Answer to this question is just know these four enzymes very well, right? Based upon these enzymes, you will be able to make things out. They are not going to kill you on that, right? They just want you to know the series. So first example, first is there is desmolase enzyme, or you can say CYP11A. Then 3 beta hydroxysteroid dehydrogenase. Now 17 alpha hydroxylase is their favorite. If you know what comes before and maybe this 17 beta comes after, in the options, really you can make things out. You don't have to mug everything up, but you know, right? In this deficiency, there is virtually no sex hormone or cortisol present, right? So you make sure you know this very well. And maybe when we'll take another doubt solving sessions, when we will have plenty of time, I can go over this again in detail. Okay, so now you know the sequence. I don't have the options, so I really cannot tell you what was the A, B, C, or D, but I have given you the entire range. Okay, now there was this question about 2,3-BPG helps unloading of oxygen from hemoglobin. How? What we know is 2,3-BPG decreases the hemoglobin affinity for the oxygen. So it helps unload the oxygen, especially it is present in the placental side, so that the maternal hemoglobin releases the oxygen to the placental side. That's how the fetus get the oxygen. Even at the higher altitudes, when we go at the higher altitudes, 2,3-BPG level increases. Reason being, we want hemoglobin, more of the hemoglobin molecules to unload the oxygen to meet the body oxygen requirement. And that we have done under the oxygen dissociation curve chapter. These are the notes from there, right? And this is like, if the curve, this is a sigmoidal curve for the hemoglobin. Why the sigmoidal curve from hemoglobin? Because hemoglobin, we know, is a tetramer. Okay? Everybody is very clear about that, right? 2 alpha units, 2 beta units. Subunits are there. And they are best buddies. They are best buddies, right? As in the movie, Chichore, there were 4, I guess. How many? But whatever, these are the best buddies. These are Chichores. And what they do is, if initially they are in the T state or tout state. Tout is like a pout. When the baby is angry, it makes a pout. I'm not going to do it, right? So that is tout. Not happy. Why not happy? They are not accepting the oxygen. Then there comes lots of oxygen in the lungs. Then one gave up. Okay, I'll take the oxygen. Then the another buddy will come. Okay, you are taking it up. There is a conformational change in alpha 1. The alpha 2 will also makes a conformational change. Okay, chill guy, chill. If you are taking the oxygen, I'll grab the oxygen. Then the B will think, okay, if you two are accommodating, let's make my conformational changes. Then more oxygen, more oxygen. So that is cooperativity among these 4 Chichora friends. And now this tout state is changed to R state. That is a relaxed state. Okay? So what happens is, when you have 2,3-BPG, then it wants hemoglobin to release it. It wants hemoglobin to release the oxygen. So it wants to shift the curve towards the right. And since it is the cooperativity, when they are taking the oxygen and while they are releasing the oxygen, right? This curve is the sigmoidal curve. The curve is the sigmoidal curve. And I have told you this thing, cadet, right? Face right. Face right. Where C stands for carbon dioxide, A stands for acid, that means the protons, D stands for 2,3-BPG, right? Or DPG, E stands for exercise and T stands for temperature. They all may move, like they all shift the curve towards the right, which means unload more oxygen. And how it is done, and we know this. We know this. What is there in the active site? What you have? You have an iron. Hemoglobin has an iron in its active site, and that is coordinating with the histidine, in the histidine. So when you have oxygen coming, it has to bind to the oxygen like this. Iron has to bind to the oxygen right here, right? It pulls it, and then what it is, it becomes a kind of planar structure. Earlier, it is a touted structure, and then it becomes a planar structure. So there is a conformational change. Don't go in detail, but there is a conformational change that happens when oxygen binds to it. So if you have to remove the oxygen, then you push it from the back. That what 3-BPG does. It pushes the iron from the other side so that oxygen leaves the space, because the histidine can bind to only one thing, either oxygen or to the 2,3-BPG, right? So probably there were options of the relaxed state, taut state, right? Or maybe the conformational changes are going on. So definitely, I'm pretty sure my students have picked that as the binding of 2,3-BPG to the histidine center in the hemoglobin molecule that is in the active site, which is bound to the iron, right, leads to the conformational change, which makes the hemoglobin release the oxygen. Okay. And these are all the questions I had. If you have more questions, please let me know. We can discuss them, right? And I wish you very good luck for the upcoming exams if you're preparing for those. For me, if I have to analyze the entire biochemistry, it is easy, very straightforward. So those who attended the classes very well, especially the biochemistry, they would have gotten most of it right. If they have attended just the GTs, they would have gotten all of them right. All of them, I would say 100% right. And recall questions, most of it is from the recall questions. I don't see any new question coming up other than this fructosamine thing, which is more of a medicine question, not a part of a biochemistry question, right? But I will definitely going to include it in the upcoming lectures, which I'm going to upgrade it, right? So that is about it, and good evening and good luck. Take care. Happy Children's Day. Happy Children's Day. Bye-bye.